This is Ophthalmology Times Europe. We are here with Dr. Patrick Bussfeld with Bayer Healthcare. And Patrick, if you can tell us a little bit about what it is that visitors to your virtual booth at EURETINA might expect to see this year, that would be great. Obviously, you know, it's a different conference than it has been in years past, and that we are virtual. So, you know, give us a little insight about what's going on with Bayer and what the attendees can expect.
Yeah, thank you very much, Michelle. It's a pleasure to talking to you and also to inform what's on with Bayer this year at EURETINA. So we are this year, of course, everybody in a very unique situation where we will not meet each other face to face, but rather more access streams available, see short snippets about presentations, and the more important is it to understand what actually the data we are bringing out in EURETINA, what they really want to tell us. And it's a really exciting opportunity at this EURETINA because we have done a kind of analysis of existing well-known studies from EYLEA, from the ALTAIR study and the ARIES studies, both studies evaluating how EYLEA best can be applied in the treat and extend setting.
So when an attendee goes to the Bayer booth, if they have questions on the data, how is that going to work? How, you know, is there some place that they can go to seek more expert information or expertise, or, you know, please explain how that will work for the attendee.
Yeah. Yes, of course. I mean, as we're now all virtual, obviously, we cannot come for a coffee to one of our booths and have more in-depth information about data. But we're offering a network launch, which is open to everyone who wants to access it. And here you will have the opportunity to chat to experts directly. We will have an Ask the Expert session, or simply chat with each other and exchange on the newest data, on your personal insights, and create this learning experience with each other that you usually have when you're on a face-to-face congress.
And is this Ask the Experts Lounge going to be available the entire time of EURETINA, or is it specific hours or specific days, or is it the whole time?
Yeah, it will be open for specific days. So there's a program also for this network launch, and this will be distributed. It's a very important topic at the moment. It's very important, and ophthalmologists around the globe discuss whether you should have a bone dry retina, whether it's okay to leave some fluid, for example, in the subretinal space, and what that does to patient and patient management. And here really exciting data come from some post-hoc evaluations from ALTAIR and ARIES. We were looking at how fluid behaves in terms of virtual outcomes. And the most important findings of this post-hoc analysis was that the presence of SRF at all time points during this study, where we looked at this, and this was at baseline at 16 weeks, at 48 weeks, and then also later to the end of the study, the presence of SRF is consistently associated with better BCVA in patients with NAMD treated with aflibercept. And that is a very important finding here. The presence of IRF was generally associated with poorer BCVA throughout the study period. And that tells us a little bit about the meaning of the drying in these different areas. So IRF is obviously is affecting the visual status of the patient much more than SRF. And we thought, and this is also the conclusion of the authors of this study, that the elimination of IRF should be the focus of proactive treatment regimens, while SRF, that is stable after an appropriate treatment initiation, does not negatively impact patient outcomes and may be also tolerated. Additionally, we also looked into the ALTAIR study, And here we found similar hints, actually. We found that patients which under aflibercept treatment who had this fluid in the SRF space, there was no difference whether there was no SRF or whether there was non-foveal or foveal SRF. So it didn't play a role whether SRF was dry or not. So actually these results again replicated the findings from the ARIES study, and actually also underscored a little bit that SRF might be tolerated, especially after an effective upload when the retinal fluid situation becomes stable. The ALTAIR study was a study with on 250 patients, which was only done in Japan. It compared a bi-weekly treat and extend regimen versus a 4-weekly increment treat and extend regimen. The outcome was actually, the primary outcome was actually that both ways of extending, bi-weekly and 4-weekly, deliver the same outcomes in terms of vision. But of course, if you extend faster with a 4-weekly extension, then you also enable a bigger proportion of patients also to become faster on longer intervals. The important thing, what was the differentiating factor between the two studies, ARIES studies and ALTAIR study, was that in the ALTAIR study, a slightly higher proportion of patients were able to come to longer intervals than in the ARIES studies. So in ARIES studies, it was roughly like 50% of the patients on intervals of 12 weeks or longer. And in ALTAIR, it was more than 60%. We have, together with the members of the Vision Academy, we have a paper set up which has looked at various interventions to improve adherence with patients. And it looked at more than 1,000 papers worldwide. And it became clear that, which is obviously at first hand a no-brainer, but obviously in real life it's difficult to actually implement, that the approaches which educated patients more, which offered opportunities to stay in contact with patients via telemedicine, for example, or other opportunities, and this is in particular important now during the COVID times, that whenever patients had access to these resources, that they were more adherent to therapy, that they stayed longer on their therapy, and that they could also benefit from the therapy. Sorry.
Are papers going to be available at your booth, or how can attendees to EURETINA get access to this data that we're just discussing, or that you're discussing actually?
Yeah, it's a good point. We will have the abstracts available.
Okay.
And we will have a medical booth where they can be requested.
Are you going to have available at your booth the times that these papers are being presented?
Yeah, I think so. We will make that available. Yeah, it's at the medical and the commercial booth. Yeah. Excellent. We want to know, okay, what's the situation for patients that are treated not only in the first year but also in the second and the third and the fourth year. And here we got very nice insights by the RAINBOW study. So the RAINBOW study is a real-world evidence study which is set up in France, covering more than 400 patients. And they have entered now also, or completed the fourth year, and it's very encouraging to see that these patients are still, for a majority, on treatment. That they have received, after they have received their upload, also were able to stay on therapy. and that they have lost after initial gain of around like 6 to 7 letters, only around 1.1 to minus 1.1 letters until the end of 4 years. And this is a very good message. So you can actually maintain even over 4 years your initial gains if you stay on therapy.
I understand you have you've also got a paper, the Centerra, on the Centerra, which is for retinal vein occlusion. If you can give us the very high level on that as well, that would be great.
So Centerra was actually a multi-center open label single arm phase 4 study where patients with CRVO could be, after a initial treatment, be extended in a treat and extend regimen. So the overall study duration was 76 weeks. So these were post-hocs, but they also showed that patients could be extended very well on aflibercept, and that they could also maintain their very, very good visual gains in this study.
We've touched on the 4 major papers that I think you're presenting. Is there anything else that Bayer is going to be introducing or will be discussing at its booth that we should be aware of?
It might be of interest that there's another study which we also showed for the first time here at EURETINA. It's called the Violet study.
Okay.
In DME. So it says that in the second year, basically it says in the second year you can achieve similar results as PRN, treat and extend, or fixed dosing in DME. So that's again encouraging for those who want to be proactive. You can actually reduce treatment around 1 injection per year, but you don't jeopardize any vision compared to Q8. You can try it with PRN and get the same results, but you need more injections. So this is also a very good outcome in terms of proactive dosing.
Well, again, this is Ophthalmology Times Europe, here with Dr. Patrick Bussfeld from Bayer, and I want to thank you so much for your time.